Hey everyone, this is Dr. Charlie Johnson, PT. Hope you are doing well. In this video, I want to share with you a simple strategy that helps you relax your back and loosen your piriformis muscles so that you can reduce tension through your back, through your hips, and through your pelvic area to find more comfort while you're living life. So it doesn't involve any type of pills or fancy muscle creams or muscle relaxers, but it's a simple way that you can actually kind of tweak how you're moving your body to, again, calm things down. So what's so neat about this is that when you understand how to apply this concept, you can use it almost in any situation throughout life. So whether you're having trouble standing, walking, squatting, getting up out of a chair, getting out of the car, doing dishes, vacuuming, weeding, gardening, shoveling snow, if you live somewhere where you get snow, it doesn't matter. Something you need to understand and know how to apply. So real quick, I'm going to talk about why this concept matters and how it works, and then I'll show you some examples of exactly how you can apply this in your life to relax your back and hips. Real quick, in case you're new to this channel, my name is Dr. Charlie Johnson. I'm a physical therapist and an orthopedic specialist, and I help people with back, butt, and sciatica problems heal naturally by teaching them how to use movement as medicine. So if you'd like to learn how you can fix yourself so you don't need pill shots or surgery or need to rely on someone else to fix you, then just go ahead and hit the subscribe button as well as the bell for notifications when I post content every single week. So how do you relax a tight lower back and piriformis or glute muscles? It's a common question. A lot of people reach out to me and are wondering. You're probably wondering the same. So many people I work with who suffer from back, butt, or sciatica problems describe a constant tension and heaviness or squeezing in their lower back, hips, and leg when they do many things. It's like they just can't get their muscles to shut off and relax. So research also supports this, so you're not crazy, and actually shows that people with back and sciatica problems are more guarded, so sort of rigid in the way that they move, and they actually fire their belly and kind of buttock muscles more than somebody who doesn't have these problems to protect themselves from pain. So it's a protective mechanism. So there was an editorial that was created not too long ago called Back to Basics, 10 Facts Every Person Should Know About Back Pain by some pretty big players in the sort of back pain treatment world. And one thing that they found is that back pain is not caused by a weak core. So weak core muscles don't cause back pain. In fact, people with back pain often tense their core, and I would argue, based off my experience, their butt muscles as a protective response. So again, just reassurance that what you're feeling is completely normal and very common. So here's what you need to know to reduce tension in your back, butt, and leg. Key concept, I'm a past teacher, so I need you to understand the why behind what you're doing. So here's a concept you can apply universally, and I'll show you how you can do that in this brief chat. So the distance of the load from the body determines the amount of effort required to blank. Fill in whatever you're having trouble with. I will talk more about some common issues here in a moment. So which takes more effort? So here you are, a milk jug example. Everybody's probably put their hands on a milk jug before, or think of a jug of water if you prefer that. But the idea is in scenario A, if you're holding the milk jug close to your body, how heavy does that milk jug, which might be 5 pounds or so, actually feel? Well, it feels like, I don't know, X amount, right? Now, if you don't believe me, go ahead and take the milk jug and try to hold it and extend your arms out and put it way back in the refrigerator. Maybe that's why they put those little spaces on the door where you can just drop it right in, so you don't have to reach, all right? But the idea is that in scenario B, the distance of the load is further from the body. So I can guarantee it's going to feel much heavier. So in a strongman competition, this would be like Thor's hammer. So they're holding like a 60-pound hammer out in front, and that's really, really challenging, right? And even these folks who are really strong have trouble doing that. So if you take something as simple or as light as a milk jug or whatever it may be in your life, the further you hold it from your body, the heavier it's going to be sort of perceived to be. And it might not just be like an object, an external object, like a milk jug or like a hammer or something like that. It could just be the load of your body. So we're going to use this concept and teach you how to apply it again as we move forward. So the further the load is from the center of the body, the more your muscles have to work and the harder it, whatever that may be in your life, becomes. This is neither good nor bad. So I want you to know that up front, it just is what it is. And you can often use this concept to either increase or decrease your pain, whichever you choose, while lifting, bending, walking, standing, doing dishes, gardening, shoveling, even sitting, and there's a lot of other things that we'll chat about as well. So that you can understand and actually feel this concept for yourself, I want you to try something. So I want you to try this. So what I want you to do is I want you to take your hand, put it on your belly, and take your other hand and put it on your back. So you can feel kind of like the flesh of your back muscles. And then I want you to stand. I'm going to stand to the side so you can see what I'm showing here. And I just want you to kind of shift your weight slightly forward. And you'll notice something. Tune into what you're feeling happen here and what you're feeling happen here in your back muscles. So go ahead, do it slightly. It's not much. Tilt forward. And what you'll notice, and I'll review this in a second, is that you'll feel something happening either in your back or in your belly when you move forward. So just pay attention to what happens. Now what I want you to do is I want you to just sway back. All right. And you'll notice that some things happen. So when I sway back, right, whoa, I have to work certain things. And when I sway forward, whoa, I have to work other things. Okay. So just get a sense for what you're feeling. So what did you notice? If you're anything like every other human being, you probably felt that as you tilted slightly forward, your back muscles tensed up. And as you swayed back, your belly muscles, the muscles in the front of your body, tensed up, and your lower back muscles actually shut off or relaxed. They didn't have to work hard to hold you up. And if you think about it, it just makes sense. So if you lean forward, the muscles on your backside switched on and begin working so that you don't fall forward. So you can see my little kind of that little red dotted line. That's sort of like the center point of your body, the center of gravity. And as you shift forward to that, picture like someone on my back saying, whoa, come back, stand up, don't fall forward, right? So your back, butt, and leg muscles are kind of playing that tug of war to keep you upright. If you sway backwards and then all the muscles on the front side have to switch on and work so that you don't fall backwards. Goof up on the grammar there, don't worry about it. But the idea is that as you're backwards, again, your toes kind of want to lift, you fire your shin muscles, your belly works, your abdominal muscles, and your hip flexors have to turn on to keep you upright. It's just basic biomechanics. So what? Who cares though? Why does this matter, Charlie? So look, the more effort from a muscle, the more contraction, the more tension that you feel. Therefore, there's less blood supply and there's less oxygen because the blood carries the oxygen to the tissues that have to do the work. There's less oxygen to do the work. So think of it like wringing out a towel, but instead of water, right? Picture that towel is your muscle contracting or squeezing to hold you upright or keep you from falling over. And that water is blood supply, right? So this is what happens. As you contract a muscle, you can cause constriction and you reduce the blood supply and therefore reduce the oxygen. And nobody likes having less oxygen, including your body tissues. So look, this is really powerful because if you can increase which muscles work by understanding how they can switch on, you can decrease how hard certain muscles work by shutting them off. A really powerful concept because it gives you control. So certain positions will feel good for your body and others will not. Nothing feels good forever. This is why there is no such thing as perfect posture. So by applying this concept, you can simply choose to turn on or turn off your muscles at any given time during any given activity and find what feels best for your body. That's the goal. So let me show you how you can apply these concepts in life, basically. So look, lifting was already covered, sort of. Basically, by keeping whatever you're picking up close to your body, you'll reduce how hard your lower back and buttock muscles have to work. So, if you're reaching the back of the car for groceries, rather than just picking it up out there, pull it close, keep it close to you. A bag of salt, if it's wintertime, whatever it may be, keep things close. But what about lifting your own body up? As in, when you're going from a sitting to standing position. So if standing up out of a chair or out of a car or something like that is painful or problematic for you, or you're trying to stand up after being bent over, maybe you just tied your shoes or something like that, you might want to consider a different strategy and kind of how you're doing it. So I'm going to show you here what I mean in a moment. Okay, so the first strategy, it's my wife, Heather, if you haven't met her. The first strategy a lot of people use when standing up out of a chair, out of a car, after being bent over, is what I call a back strategy, all right? They lead basically with their back. So this is what it looks like. So this is strategy number one. Again, I'm not saying it's good or bad, just this one requires more effort from the back than the other one that I'll show you. So you can test it out and let me know which one you choose. And maybe you post it in the comments, all right? So first strategy, back strategy is this. So as you're standing up, you lean forward, and then you do one of these, and then, and you're up, all right? So in that one, use your back muscles to lift. Notice my hips aren't really doing much. My back is doing all of the work to help me get upright. So that's the first strategy and the most common strategy I see people use if they have back, butt, or sciatica problems. Now, the second strategy, and this is one that I often recommend, but again, try it out and see just which one feels best for your body, is kind of a hip strategy. You're leading with the hips. All right, so here's what it looks like. So you go and you lean forward to stand on up, but then what you do is, as if someone's pulling on your hips, you drive through the floor and you push your hips forward. All right, so let's do it again. So you go here, she's pulling, 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 and I drive with the hips. So sort of doing like a little pelvic thrust sort of idea. So notice in that hip strategy, sort of second strategy I just showed, the back muscles aren't working as much. The hips are driving your ability to stand up. A lot of times it relaxes the back muscles and makes things feel better. But again, give it a try. So one way to train that second strategy, if you found that feels a little bit more comfortable, is to, you have someone, beautiful wife, beautiful partner, whoever, dog, cat, doesn't matter. They can kind of be behind you, right? And you're trying to go this way with your hips. You're trying to kind of pull the hips up and forward. So have them pulling down and back very gently with a band, or doesn't really matter, just something to give you feedback. And what you're going to do is you're going to lean forward and you're going to pull into the band. So it's nice. It's a little bit of a, what we call an external cue. Sometimes it's hard when you're in your own body to change the way you're standing up. So if you don't have something like this, it ends up looking like this. And it's just really awkward, all right? So the idea is not to keep your back upright per se. The idea is just to give yourself something that gives you some feedback so you know and you have something to feel against your body and you can pull into it. Now, if you don't have a band or something to hold, you know, a rope or a cord or whatever, you can just use your hands. So place your hands here on your hips and then you can feel yourself disconnecting my audio. All right, so from the side, you can put your hands here and push your hips into your hands. So it's another way to train the second strategy. Again, not that it's good nor bad, it just activates a different part of the system, and a lot of people find it more comfy. So now let's talk about walking. So many people with back, butt, and leg problems walk slightly hunched forward. Some will say that this is because of pain. Others, it's just a habit. So do you walk by leading with your head or with your hips? So this is just something to think about, right? And depending upon your answer will determine which muscles are working more. So again, many people have had pain. Lean slightly forward as if they're walking into, you know, a stiff wind. So think of kind of walking ever so slightly tilted forward. And this causes the lower back and glute and calf muscles, which by the way is where the sciatic nerve travels, to work harder than needed. And this can increase the tension in the system, reduce the blood supply, and again, reduce the oxygen. So as you walk, place your hands on your back muscles. You'll notice that if you're tilted forward, they turn on. So here, right, you're pretty neutral to that vertical line. If you're back, your abdominal muscles work. If you're forward, whoop, they switch on. You can notice ever so slightly, that's where they turn on. All right, and if you're walking like that and you're not aware of it, then you're going to be turning these muscles on unnecessarily or more so than needed. And you're going to be putting a lot of strain through the back, butt, and leg muscles. They're going to be doing a lot more work. Therefore, you're going to have a lot more tension. They're going to feel consistently tired and potentially painful. So can you relax your back muscles, glute muscles, things like that, and turn them off? Of course you can. So pull your head back, lean a bit more, or lead a bit more with your hips by swaying slightly backwards. You'll notice it's not a big movement. Again, you want to find that tipping point where your back muscles shut off. All right. So again, you're here, that turns it on. Look how little that is. Just like an inch sway, turns it on, turns it off. Right. And if you notice that, you know, that point, and you can train yourself to find that tipping point, then you can walk, you know, stand and do other things with less effort. And now what you want to do is you want to try that out and just see, how does this impact your symptoms? So does it feel better, same, or worse to walk like this? Just go ahead and give it a try. You can apply the same concept to standing, doing the dishes, weed whacking. I don't know if that's how you spell weed whacking or not. Maybe there's an H. It doesn't matter. I spell it differently later in the presentation, all right? Snow shoveling, it doesn't matter. Once you get this concept, you're more in control. You understand how you're able to control your symptoms, and you have more options. So you have a switch, which is pretty cool. So how do you stand? Is your weight is neutral or backwards, or is your weight shifted slightly forwards? Test it out and see, right? Noticing this, how can you move your body in a way that puts you in control of how you feel when you do lots of other things? Think about what happens when you're washing the dishes. This is common that when people are washing the dishes stooped over, maybe you're putting on makeup, brushing your teeth, it doesn't matter, or loading the dishwasher even. Do you stand with your weight slightly forward? Now, here's the thing. If you're washing dishes or leaning over a sink, then you've got something blocking you. So it's really hard to kind of like be over top of it and be upright. Otherwise, you'd be like drooling all over yourself, right? So what you could do is you could open up a cabinet and place one foot underneath, and you see how that kind of distributes the weight a little bit differently and supports the body so your back doesn't have to work as hard. But what about the way you vacuum? You have a choice of how you do this. So sort of on the left side of the screen here, you can see that my body is slightly shifted forward. And if I were to walk up to me in this picture and put my hand on my belly and put my hand on my back, I'd say, oh, your back muscles are turned on, Charlie. But in the one on the right, where I'm kind of upright and or slightly swayed back behind that line, my belly muscles would be working, but my back muscles would be pretty much shut off. So again, one is not necessarily better than the other. You just want to test it out and see, have you been doing it like that, the one on the left side, or like that, and find out which one feels best. So how can you apply this concept mowing the lawn? So a lot of people, you have option A where you're sort of pushing the mower, or you have option B, which is, the one up on the top right there, where you're sort of walking behind. So if you have a self-propelled mower, that would be awesome. If you don't, I guess you're just gonna have to push it, but consider how this impacts your symptoms. So option, one on the left here, you can see that my body again is tilted forward. It's gonna turn on my back muscles, reduce the oxygen because it's gonna reduce the blood supply by constantly contracting the muscles for however long it takes you to cut the grass. In the option where you're more upright, your body is better, quote unquote, aligned or stacked such that the muscular effort is going to be less overall. Weed whack, I spelled it different here. I have no idea, but on the left, right, I'm leaned slightly forward. On the right, I am not leaned as far forward. So one is going to require more effort. You still get the same job done. So go ahead, test it out and just start to tune into and become aware of your body and how you're moving your body and how it impacts your symptoms. When you shovel, it doesn't matter if it's a snow shovel, a garden shovel, it doesn't matter. Again, on the left, I'm tilted forward. On the right, I'm pretty vertical. Or when I do have to reach forward, I slide the shovel back and I keep it sort of centered with my body. If you are weeding or picking things up or roasting marshmallows, I like to roast marshmallows. So, on the left, you can see that I'm tilted forward and I've got all that weight, over top or in front of that line, which is going to require my back, my butt, and my lower, my back, my butt, and my calf muscles to kind of contract, squeeze, and hold me up. And if it takes me, I don't know, if you're someone who likes to stick your marshmallow in the fire and light it on fire, then it's going to be pretty quick. I don't really care for that. But if you're somebody who likes to roast it slowly and spin it until it starts to kind of get gooey and is about to fall off, then you could be there for a while, right? And this could really bother you. Or on the right, you can see, actually you can't really see, but my elbow is actually on my knee. So I create kind of like a pyramid, a support system, if you will, and the elbow on the knee acts as a sort of table leg and it shuts the back muscles off because it supports the body. Or you can apply the same concept doing whatever. So if you're shoveling, right, and you're on all fours, notice how my hand, again, just like the elbow in the roasting marshmallows example, the hand acts as a table leg and it helps reduce the amount of effort for the back muscles. But if you're, clipping roses or picking flowers or whatever, and you're leaning forward like this, this is, maybe too far, such that the further you reach, the further the load, even if it's just the weight of your arms and the clippers and, a rose, the further it is from the body, the more your back muscles are going to have to work. If you're chasing a chicken or doing whatever, it doesn't matter. Again, if you're reaching out, the further the load is from the body, the more your body's going to have to work. So just some things to think about no matter where you are or what you do in your spare time. So how can you apply the same concept while sitting to find relief? So a lot of people have been told that there's such thing as a good posture, that they have to sit up tall. Well, guess what happens when you sit up tall and you buy a yoga ball and things like that? Look, if it feels great, cool, totally do it. But for a lot of people, it just means that your back muscles are tense and have to work to hold you up. And if you do that for hours during the day because someone told you that it was good, right? And because of that, you're boxing yourself in and you're telling yourself you have to sit like this, then you could be preventing yourself from getting better. Because look, if you just chilled on the right side of the screen, then you could shut off your back muscles and you might find they're actually more relaxed. So again, test it out and find what feels best for yourself. Now, how about working out? So if you used to go to the gym, or you're currently going to the gym, but you're trying to find better ways to do it so that it doesn't flare up your symptoms, and you're trying to relax your back and buttock muscles. This was a study that came out of basically University of Southern California. Chris Powers, he's a big researcher as it relates to kind of hip and knee stuff. And what they did is they basically took various body positions during a lunge task. So you can see that in the yellow kind of line there, they did a lunge with the trunk extended, the green line kind of vertical, right in line with the center of mass or center of the body. And then they did that pink line where the trunk was tilted pretty far forward. And they wanted to assess, hey, how are the muscles working, in these various positions? And surprise, what they found is kind of what we already know, or what we speculated, which is basically the more forward the trunk is tilted. So the better the angle, or the bigger the angle going forward, the more you work the backside of your body or the hip muscles. So the more upright you are, the less work for the backside of your body. In fact, the more upright you are, the more you work the quadriceps, or the front of your thighs. So how can you apply this? Look, if you want to keep working out, try lunging with your trunk upright. Or if squatting, try doing wall squats. So again, a lot of people, when they lunge, they think there's a certain way to do it, a right or a wrong way. So maybe you were taught this is good or this is bad. It doesn't matter. This way with the trunk upright is going to work more the front of your thighs, your quads, versus if you tilt that trunk forward, it's going to work more your glutes, or your buttock, or your lower back. Again, you just find what feels best for your body. So is this making sense? Hopefully, you're getting how to apply this concept in your life. So remember, the entire goal of treatment for people with back, butt, and sciatica pain is to calm the nervous system down, to turn down the volume or turn down the sensitivity of your pain alarm system. So what we know is that pain equals danger. And there is no right or wrong way to do things. Rather, the best way to do things is in a way that feels safe for you and feels good for your body. So instead of listening to what others say, including me, right? Hopefully you can tell I don't claim to be right or wrong or know everything. The idea is I'm trying to give you options to empower you with different ways that you can sort of, explore movement-wise to reduce your symptoms. So tune into your body and begin exploring motion. Feel good about doing it and find what feels best and safest for your system. So that's it. I hope this helps you out. I hope this teaches you, right, and gives you some options for reducing some of the tension in your lower back, buttock, and sort of sciatica regions. Again, kind of ironic. People with back, butt, and sciatica problems feel a lot of tension in their calves, their buttocks, right? Yes, anatomically, that's where the nerve travels, but also these are the areas that get tense. And a lot of things in life increase the tension. And a lot of things that we're told to do because it's right, good posture, the way that you should be moving your body, actually contribute to continued tension in these areas. So wherever you are and with whatever you're dealing with, I hope this was valuable. What I want you to do is just comment below and let me know what you learned and what you found most helpful about this video. If you're searching for the cause of your pain still and you're not quite sure, just go ahead. You can check the link below, DIY Diagnostic Guide. Go ahead, grab your free copy by clicking the link in the description and or the comments below. And I know that'll be a huge help to you. And until next week, again, that's all I've got. Take care, everyone, and we will chat soon. Thanks so much. Talk soon.